Hello and welcome to a special three-part community town hall event on COVID-19. I'm Felicia Edie and I'll be your host for this evening. On March 6, 2020, South Carolina announced it was investigating the first 2 possible COVID-19 cases in our state. Since that time, COVID-19 has impacted our way of life in ways we could not have imagined. Today, the arrival of a safe and effective COVID-19 vaccine has brought a renewed hope and a brighter tomorrow. However, much work is still needed to help South Carolina and the country achieve herd immunity and end the COVID-19 pandemic. Tonight's conversation is an opportunity for you to ask questions of and hear directly from public health experts, medical professionals, and community leaders about the safety and effectiveness of the COVID-19 vaccine. We've already received several questions from South Carolinians prior to this evening, and we'll also be monitoring our social media feeds throughout the event. We will do our very best to get to as many questions as possible during our time together. To begin tonight's 3-part event, we are joined by Dr. Edward Simmer. He is the director of South Carolina Department of Health and Environmental Control, also known as DHEC. We also have Mr. Thurton Corby. He is president and CEO of the South Carolina Hospital Association. Also joining us is Dr. Wendell James. He is the chief clinical officer for Prisma Health in the upstate. And we also have joining us today Gail Receder. She is the executive vice president and COO of Tidelands Health. And also rounding out our group this evening is Reverend Michael A. Butler, pastor of New Hope Missionary Baptist Church in McCormick, South Carolina. Reverend Butler is joining us by way of Skype. He's joining us virtually. Welcome to you all, and thank you so very much for being here. We really appreciate your time. Dr. Edward Simmer, we want to start with you. When it comes to the spread of COVID-19 at the state level and the national level, what are we seeing now and why are we seeing this?
So we're making good progress. We still have a lot of cases of COVID. There's still risk, especially for those who are not vaccinated. But it is getting better. At the worst, we had more than 1,200 patients a day in the hospital for COVID. That's down to about 300. That's still too many, but it's certainly better. We do have some variants in the state, and those variants do seem to be responsive to the vaccine, so that's the good news. But for those who aren't vaccinated, they do spread more easily and fast. So there is still significant risk from COVID in the state. Certainly nationally, we see the same sort of picture. We are now seeing that younger people are getting more cases of COVID. I think one of the things in South Carolina we've been very successful at is vaccinating the highest risk people, and those over the age of 65, those with medical conditions. And I think that's one of the reasons we're seeing fewer hospitalizations. So now the cases now are more in young people. People ages 18 to 35 are getting many more cases of COVID than we saw earlier. So we're still very much focused on getting people vaccinated. At this point, we have about 1.5 million South Carolinians are fully vaccinated, and that's great news, in less than 6 months. And we have given over 3.5 million doses of the vaccine. We have 3 very safe and effective vaccines. And our slogan is, don't wait, vaccinate. If you haven't been vaccinated yet, the vaccines are available all across the state. And we strongly encourage folks to get vaccinated. Now, anyone 12 and over can get the vaccine. If you're 12 to 17, you have to use the Pfizer vaccine. 18 and over can use any of our 3 vaccines. So again, I think we're making great progress, but there's still much more work to do. And that's one of the reasons we've been able to tell folks that if you're fully vaccinated and you choose not to wear a mask, you don't have to anymore because it's safe. The risk of getting COVID or spreading COVID if you're fully vaccinated is very low. So that's the good news. I'm choosing to wear a mask tonight even though I'm fully vaccinated because some people do choose to do that, and we need to respect that choice. And certainly say if that's your choice, that's great. But if you're fully vaccinated, you don't have to. For folks who are not fully vaccinated, they still need to wear their mask. They still need to socially distance, which is a good reason to get vaccinated, so you don't have to do that anymore.
I'm glad you mentioned that. I was going to ask, for those watching, they can visibly see you're wearing your mask, but thank you so much for sharing that. We do have a lot of information coming out, so that was really, really great. Thank you so much for sharing. Here in South Carolina, we have many unique remote and rural communities. Reverend Butler, I want to direct this question to you. What impact of COVID-19 have you seen on these communities?
Well, in the rural communities, many times we were historically left out the resources and the things that were available to others in the larger cities. But in this case, we just like everyone else, and we were thankful for the concerted effort that DHEC made to reach out to the rural community, also the underprivileged community, and make the vaccine. And it has certainly helped us in the community and the rural communities as we were able to take the numbers down, those who have been infected, and also died from the virus.
Dr. James or also Mr. Thornton, I want to throw this question out to you. What does it mean for us now that we have more and more doses of the COVID-19 vaccine coming into our state? What does that mean for us here in South Carolina?
Go ahead. Oh, I think it's a wonderful thing to have this. Early on, we were vaccinating people as fast as we could get vaccine. And now we have the luxury of having enough vaccine to really rapidly vaccinate people. I think that one of the things that people need to realize is this is a very, very safe vaccine. We have lots of it available at this point, and the fact that we have it had to throttle down earlier vaccination efforts somewhat, it made people maybe think that we were not as serious. I was afraid of, of getting them vaccinated, but now with the volume of the vaccine going up and the availability easing, we need to once again push forward with people understand we need to get you vaccinated. Having more vaccine in the state at this point is very critical to how we go into next flu season. The thing that we've forgotten about is when we had COVID at its peak, we saw no other viral illnesses to speak of. Flu was gone, RSV was gone, adenoviral colds were gone because people were doing things that mitigated viral spread. Now people are relaxing what they're doing, and we're seeing all of that come back. And as we move forward into flu season, we'll see flu again if we do not take measures, vaccinate for flu, and vaccinate significant numbers of people for COVID. And so having the vaccines available at this point is going to be incredibly advantageous to the entire state.
So this next question was actually emailed to us. B. Dixon says, after researching and reading several studies and sources, why would someone who has had full-blown COVID get the vaccine when percentages of reinfection are low or rare?
So I can start with that. I think the data that we have shows that although you can get some immunity from having COVID, to be sure, the antibody levels and the amount and duration of the immunity you get seems to be longer from the vaccine, especially if you had a relatively mild case of COVID, by which we mean you didn't have to be hospitalized. The getting the vaccine, even after you've had COVID, gives you more protection, gives you longer protection. And for those reasons, that's why we still recommend folks get the vaccine after they've had COVID, because it means that they will have much less risk of getting another case of COVID or spread it to someone else.
Okay. Gail, I want to ask you this question. What are some of the ways that we can better reach those residents who live in our unique rural and remote locations?
Well, I would tell you that it's been a challenge because if you think about all the elements of communication we've needed to do all through our COVID journey, from the very beginning of trying to communicate symptoms, likely symptoms, screening, testing, quarantine protocols, they changed a lot early on, and we needed to get very timely, reliable information out to communities. And so what we did at Tidelands Health and along the coast in Horry and Georgetown counties was began to just really look for where are those public-private partnerships with DHEC, where are those partnerships with our community partners, churches, other social organizations, the NAACP. We found ourselves really working very collaboratively to get the right message out to folks. We found that the messenger matters in terms of the confidence that people have in that. We spent some time really looking for opportunities for patient testimonials, or whether they might be a local community leader or a healthcare provider, physician, others, and really had to go to them. I think in South Carolina, I think we did a really nice job, very much collaborating. I think as Reverend Butler said, that collaborating with DHEC and DHEC's Public Health to really find our way out to those communities in a way that we probably had never done before. So I think there are challenges, though, with communicating very timely, access to broadband and other limitations that you find in those really rural communities is a challenge.
Alicia, could I add to that?
Yeah, absolutely. Yeah.
I just want to build on the question you asked Dr. James and Gail. When we first started out, most people were getting their vaccines through a hospital because that's where we concentrated the vaccine. When you ask about how to get into rural communities, DHEC has done a much better job now that we have more supply of getting it out to our normal vaccination channels, doctors' offices, pharmacies. And so it is in many, many more places in this state. That's been a big help. And then the legislature and DHEC have also worked to have regional advisory panels to make sure we're reaching all those corners of the state. But when you asked Dr. James, what difference does it make that we have an abundant supply now? We're not doing as many vaccines in hospitals. We're doing more in the normal channels where people would normally get their vaccine. So it should be easier to most South Carolinians.
How easy or hard was it, or is it, to build the relationships needed to go into these communities to vaccinate people?
So I'll speak to that just a bit. When we first started, the first thing we realized was we had a community in the Greenville area that was just real high numbers of COVID patients coming in, largely Latin. And we were like, how do we do this? So we went to our churches and went to the pastors, and we said, we need some platform to talk to your group here. And so they would go into the churches. We went into some of our PASAs. I believe we have several Latin American PASAs. Thank you. Groups that we work with and through in the community. We approached all of them, but to the point you made, it's not sometimes how much you say, it's who says it.
Yeah.
Right.
And we had a significant response from doing that versus us trying to push out information from Prisma or the upstate facilities. Much more receptive ears when it's coming from a pastor or someone that they know.
We have yes, go
If I
ahead.
could give a quick example, that Reverend Butler, who of course is here, in his church have given more than 2,000 vaccines. So I think that's a great example of a community partner that's really helped us. They actually got our Community Hero Award for the great work they're doing. But there's many different churches and community groups across the state, and we're always open to working with more. So certainly, if you have a church or a community group and you'd like to work with us and run a vaccine event, let us know. Come to our website, scdhec.gov, and we will get you set up.
Vital information. Thank you for that. We have about 4 minutes left in this segment. I want to just kind of like round robin quickly with each of you. What core message do you want the people listening in South Carolina, all across the state tonight, to know when it comes to COVID-19 vaccines?
Sure. Don't wait, vaccinate. That's absolutely the #1 message. We have 3 very safe vaccines. They've been given to millions of people across the country and around the world now, with very, very few side effects. We know they work. That's why we're seeing the reduced case numbers, the reduced hospitalizations, is because these vaccines are working. But we need to get more folks vaccinated yet. We are on the cusp of being able to say we control COVID instead of COVID controlling us, and that's a great thing. But we're not there yet. We need more folks vaccinated to get to that point. If you can't find a vaccination site, visit our website, call us. We will help you find one. We're working with places like Prisma, and they have mobile units that will go out into communities. We will get the vaccine to you. Just let us know where you are.
Mr. Kirby.
I would say the most important thing is South Carolina has a great team working together. There have been no turf lines. No one says that's not my job, whether it's the governor's office or DHEC or hospitals or the pharmacies. Everyone has said, tell me what we can do to help treat patients, get people vaccinated, get tests out. I'm really proud to be in this state where everyone is focused on being part of an effective team to make sure every person in this state has good health and is vaccinated.
Yes.
The thing I would like the public to hear is vaccination is our segue back to normal life. We are never going to be able to fully return to that until we get a significant number of the population around the entire country vaccinated. And that is something that they need to understand. If we want to get back to normal, the quickest way to do it, get vaccinated. Yeah. Do not ignore this. This is not gone. We just need to continue what we're doing.
And Gail, you get the last word. Well, no, one more after you.
You know, it's not gone. I left our hospitals today, and there are still patients hospitalized today in our hospitals. So we're a long way away from this. Just echoing what Thornton said, I think I've never been prouder to work in healthcare. I think our state has done an incredible job, and there's just so much opportunity. We're so close to really being able to begin to start seeing light at the end of the tunnel and getting and seeing our economy back in check, our tourism back in check along the Grand Strand. But there's still a lot of risk out there with what we might face in the next several months. And I think really doing your own homework, looking for that reliable information from your health systems in your communities to DHEC's website. There's a wealth of very reliable information, and there's a lot of misinformation out there right now about the vaccine. I'm fully vaccinated. My 24-year-old daughter's fully vaccinated. It's really time for the rest of the community to find the right information and to heed Dr. Zimmer's advice. It really is time to secure a vaccine.
And Reverend Butler.
Yes, I think one thing that we have to continue to do is not let our guard and continue to encourage those who have not been vaccinated to get vaccinated. And even those who have vaccinated, not to let your guard quickly, because the science says that we see the virus, and that's very important. I also think it's important that we continue to collaborate. For instance, in McCormick, we didn't do it all by ourselves. Certainly, we were grateful for the opportunity to partner with DHEC and Self-Reach Hospital, but we also collaborated with our local government officials more than we ever have as a church, also with our Chamber of Commerce and others in the community to help get the word out. Our churches were instrumental and still continue to be, and we just have to keep encouraging folks to not let your guard down. As we say in the church, to serve this present age is our calling to fulfill. So we're here to help, and that's what we need to do.
Thank you so much, Reverend Butler. In just a moment, we'll be joined by a new panel to continue our conversation about the COVID-19 vaccine. Stay with us.
All South Carolinians are now eligible for the COVID-19 vaccines. For help finding a vaccine location in your area, visit scdhec.gov/vaxlocator or call 1-866-365-8110. COVID-19 vaccines are free and don't require ID or insurance. Visit scdhec.gov/vaxlocator or call 1-866-365-8110 to find a vaccine location near you.
COVID-19 has taken so much from us, but now the COVID-19 vaccines provide us with an opportunity to move forward. Getting vaccinated isn't just a powerful decision for yourself, it is also a powerful decision for your community. Be a leader to those around you and get the COVID-19 vaccine. Together, we're stronger than any virus.
Any vaccine or medication can cause side effects. These are typically minor, such as a sore arm or low-grade fever, and they go away within a few days. As with all vaccines, COVID-19 vaccines are not approved until clinical trials have taken place and they show that they are both safe and effective. Safety is the top priority of any vaccine. Results from the first COVID-19 vaccine show no serious side effects.
Hello, I'm Dr. Linda Bell, state epidemiologist. Even though vaccines have arrived to boost our efforts to end COVID-19, some people are skeptical of the vaccine. African Americans and other people of color are especially hesitant, given the history of previous scientific research. While I understand the distrust, I also know the result of that history. All studies now require strict oversight to protect human subjects. COVID-19 vaccine development was thoroughly reviewed, and these vaccines were determined to be safe and effective. When it was my turn, I was eager to get vaccinated, and I hope you'll do the same. While we wait for more vaccine supply, we still need to be careful even after we get vaccinated. Together, we're stronger than any virus. Let's roll up our sleeves and fight COVID-19.
One of the things that COVID-19 has done is to shine a greater light on the existence of health disparities across the United States and right here at home. At the national and local levels, data shows that African Americans and other minority populations are not only disproportionately impacted by COVID-19, but also currently are vaccinated at a lower rate than others when it comes to getting the vaccine needed to protect themselves. To help us better understand why these disparities exist and what is being done to support our communities of color, we are joined by Dr. Linda Bell. She is South Carolina's lead communicable disease expert and our state epidemiologist. We also have Reverend Charles B. Jackson Sr., pastor of Brooklyn Baptist Church, located in West Columbia, South Carolina. Also joining us is Evan Segura, program manager of the Hispanic Latino Affairs with the South Carolina Commission on Minority Affairs. And we are also joined this evening by Dr. Rosalind Clark Artis, president of Benedict College, a private historically black liberal arts college in Columbia, South Carolina. And Reverend Nelson Rivers, pastor of Charity Missionary Baptist Church, located in North Charleston, South Carolina. Reverend Rivers also serves as the Vice President of Religious Affairs and External Relations for the National Action Network. Thank you all for being here. We greatly appreciate your time this evening.
Thank you.
So Dr. Bell, we want to start with you. We want to start the conversation with you by telling us, how do these disparities impact a community's health, especially now during this pandemic?
Of course. So there's really two ways to think about how disparities impact health. First is really at the individual level. Individuals who have experienced inadequate access to jobs, to pay, to housing, and access to care results in them being more likely to have chronic medical conditions. And because of these societal circumstances, people that experience these inadequacies typically live in the same communities. So we end up having pockets of communities that are experiencing these inadequacies and are vulnerable populations in entirety. So what COVID shined a light on is that when we have entire pockets of communities who are vulnerable or susceptible to a virus that affects people disproportionately when they have underlying medical conditions, then we've seen that disproportionate impact. But an important thing to understand is that when we have a disease that's transmitted from person to person, that when we have pockets of vulnerable communities, we're actually all susceptible because we rely on the same resources for health care, for personal protective equipment, access to medical treatment. So when there is a disproportionate impact on any pocket of a community, we are actually all suffering from that. So the importance of addressing COVID to address those who are most vulnerable actually helps all of us. And the other thing to understand is that these individuals in these communities who have experienced these inadequacies for decades, in fact, we have done a lot to remove barriers, and we want to create every opportunity now for individuals who have those barriers to have every opportunity for access to care, and particularly to the vaccines.
Our faith-based communities play a large role in educating and encouraging members of their congregations and therefore members of our communities. I want to ask Reverend Jackson and Reverend Rivers, how are you addressing this vaccine hesitancy in your congregations and therefore throughout our communities?
Thank you for the opportunity to share with you. Initially, I had a wait-and-see approach to the vaccine. It was a very short duration because I was convicted by the Spirit that lives within me. God seemed to have said to me, "What are you waiting to see? Have you not seen the pain and suffering? Have you not ministered to death situations in far greater measure than any time in your pastoral ministry?" And so I was convicted. And when I became convicted like that, because of the relevant ministry which we've always tried to serve at the Brooklyn Church, I said I need to do something about it, because I was weeping over the suffering of so many, particularly in the African American community, because I saw that the suffering was disproportionate as well as the deaths. And so therefore we spoke with the president of the Lexington Medical Center, Todd Osberg, and asked could we set up a site there, a clinic there at the Brooklyn Church, so that we can make that available, because my experiences with African Americans is that they will trust the church and perhaps the black pastor when they might not trust the hospital or the system. And so therefore we opened up the clinic on March 11, and it has been serving the vaccine from 7 to 5 every day, and even on Sundays from 1 to 4. And we first began, we were having averaging over 800 persons receiving the vaccine a day. I borrowed something from Vince Ford, vaccine vacation on the right hand, virus ventilator on the left hand. You choose, as the one who's wise and intelligent, what you think is in your better interest. The vacation from the vaccine, the ventilator from the virus. And so that's where we're going to push it. And so we started out, and as a result of that, the African American numbers began to increase. And then all of a sudden we had this lull, and no one was coming. And so we decided that we would select about 5 teenagers as ambassadors for the vaccine. And so they did a video, each of them indicating that they had taken the virus, pictures were taken of them, they posted on their social media, and they are encouraging teenagers likewise to come and receive the vaccine. So that's how we're trying to address it at the Brooklyn Church.
Reverend Rivers and Dr. Bell, I want to ask you, we actually have a question from one of our viewers who wants to know, can you talk about the recommended guidelines for having church, for our places of worship?
Well, I wanted to say thank you for having me. I want to give a shout out to Dr. Bell. She may not know this, but in the black community all over South Carolina, she's a shero. And I want to make sure people knew that, and she knows that. I only got 2 autographs in my life, Rosa Parks and Daisy Bates. I'm about to get 3 because I'm going to get Dr. Bell's autograph. Now to answer your question, black folk, at least in my experience as a pastor and also a civil rights worker, were ready for the vaccine. There was some suspicion, but they were ready for the vaccine. The suspicion was, at least in my conversations, that we were going to be last to get it. And so our church partnerships with Mount Moriah, My Church Charity, Royal Baptist Churches, all of us have been involved in getting the vaccine done. And we were doing really well, frankly, until Johnson. When the Johnson scare came, it ran off the table. We just had one today down in North Charleston at the Athletic Center with Franklin C. Fetter, which is doing a tremendous job. One of the heroes that doesn't get talked enough about are the federally qualified healthcare centers, specifically Franklin C. Fetter and Dr. Aretha Powers and the great work we've done. We started last year by asking the governor, we challenged, DHEC, to his credit, was the first state agency I found out around the country that had the numbers by race. So we found out that black folk were dying, almost twice our numbers in the population from the virus. We said something has to be done, so we started something called the movement, THE, Testing, Healthcare Access for All, and Economic Equity. In doing that, we built relationships in 9 counties, and we assisted with about 30,000 tests. That flowed nicely into getting people vaccinated because we have relationships, the churches are willing to do it. We've not found the hesitancy in the churches, but in our community, frankly, because a lot of folk who had what Reverend Jackson had, that suspicion, when Johnson happened, even though it was the right thing to do in the pause, that gave them an excuse not to come. And I think this is critically important. I commend you for doing it. A lot of folk are going to hear the truth today that would not hear it otherwise because their main source of information is disinformation. Facebook is not good for that. Instagram is not good for that. It's very important that you, credible people who can testify about what happened, speak to this. And I think in our case, we have found that folk were willing early. Then Johnson happened. Now we have to come back and figure out how to reassure them. And I end with this. I found this out. There are some people who cannot build the antibodies. So they asked me to ask you the question. If you won't get vaccinated for yourself, isn't there somebody you know that if you don't get vaccinated, you risk their lives, risk their health? And so the question becomes, who, if not you, then who else is worth you getting the vaccine for? In our community, we have to really be honest and transparent that folk are now suspicious, and acting like they're not does not help. We have to have the information, we have to be confident, and lead by example. My wife and I got our shot January 20th, got our second shot February 17th, shout hallelujah. I did worse with the flu, and the shingle shot than I did with the Moderna shot. I'm not atypical, but everybody doesn't have that experience. But frankly, when you have 600,000 people die around the country, several thousand in the state of South Carolina, the better question is, why would you not get vaccinated? If you could cut this and stop this as a person of faith, why would you not do it? What makes you so scared or selfish that you won't save lives? And the vaccine saves lives.
Thank you so much. Dr. Bell, I did want to circle back to you. I've talked to people in Richland County, Berkeley County, other places across the state, and churches are making plans this month and next month to reopen. Are there guidelines for safe church worshiping?
There are guidelines, and we have provided these guidelines. They are based on the principles of keeping people from being exposed. And I do want to recognize our faith leaders here and how much influence they have. And we recognize the importance of worship, particularly at this time. And so we have said all along that there are safe ways to do things. And if the importance of people gathering, if they're not vaccinated, though, they must still wear masks when they're going to be around other people. I appreciate how many churches and worship centers have put in measures that will make sure that people are still physically distanced. Religious services are a risk because of the duration of contact, so it's really important that those things be in place to limit the number of people who are in a sanctuary and worshiping at one time are important. So I do want to thank our faith leaders for following the guidance that's available on DHEC's website. And these are principles that are important in any place when we're gathering in public, that people, if they're vaccinated, this is the beauty of this benefit, that they can do these things safely. But there are still so many people who are unvaccinated that in order to protect them, these churches must still, to protect the people, require masks, practice the physical distancing, and limit the number of people who are there at any one time.
Thank you. Evan, could you talk about any specific challenges you are seeing when it comes with our Latinx communities?
Yeah, first of all, thank you for the opportunity. I've been advocating for the Latinx community for about 20 years. And I can tell you from the beginning until now, the number one issue that we have is the lack of access to information. And then we have services and programs and resources available, but the community doesn't know. And then we have needs. And we have issues in the community, and the agencies and organizations don't know what's going on. So just making sure that that information comes out, that's one of the biggest issues. We have a healthcare system that's designed mainly to serve one group of the population. And when we start talking about minorities and people with different backgrounds, different cultures, sometimes different languages, that's when the issues come. And that's when we get disenfranchised communities, underserved communities, and just the issue that, well, and this is happening for a long time. And that also creates some mistrust in the community. They don't know. But in this time, I think like the silver lining that I found on this is that we understood, all the organizations, that this is something big that we need to start working together. It used to be harder before to get somebody from Charleston, a community organization in Charleston, to work with somebody from Greenville, because it was different areas or something. But now with technology and everything, we learned that we have to be working together. Also, we recognize that DHEC is doing a very good job in trying to work with organizations. There is still a lot to do, but we've been working with them in translating materials. And I say this all the time, it's not only to have the materials in the language that they understand, it's also, once you have that material, what are you gonna do with it? Even better, why don't you bring people from minority communities to the decision room? To the room when they make decisions, how are we gonna do this outreach? Like, instead of becoming an afterthought, when you say, hey, I have a flyer, can you translate this? Why don't you invite us to the table when we can decide how we're gonna design this flyer? How are we gonna design this strategy to reach to our communities? And for me, I'm fully vaccinated too. When I decided to do it, I can think of several reasons. For me, for my family, for my community, because I trust science, but in the end, it was because this is a matter of public health. In this, we are together. This is a virus that doesn't respect your income level, your race, your age, anything. And like, as humans, that's when you realize we are humans, we're in this together. We should do this because it's a matter of public health. And that's the task that we're doing these days, is just making sure that if somebody has a question, we need to bring them the right information. We cannot make people get the vaccine. But if somebody wants to get the vaccine, we should be able to tell them, hey, here is the site when you can find out exactly where you can take it. If you have a question, here is the right information. And that's been a lot of our job in the last 12 months, is just making sure, like I said, that that information comes to them and that we are misspelling the myths that you were talking about, just making sure, like, hey, this is the right information. Make an informed decision. And if you want to get tested or the vaccine, here are the places where you can do it.
Dr. Artis, what can we do with what we've learned so far? How can we employ what we've learned so far in our response to continue this fight and continue to decrease the gap in disparities that we've seen?
Sure. As the representative for higher education, we are second only to the faith community in terms of being a cornerstone, and particularly minority communities. Our job is quite simple: to engage, to partner with DHEC and people who have the information that our students, our families, our communities desperately need, to advocate. When we see an issue, we go to the root cause. We knew that people were not being vaccinated early on because they were unable to navigate the online registration system. So when we recognized that, we immediately set up workshops to talk and walk people through that process, and ultimately to educate. Getting the right information from professionals like Dr. Bell, from professionals at DHEC, and distributing that in channels that our students will recognize, hear, and understand. So social media has become a tremendous asset to us. While it is not the way to get your best scientific information, it is certainly a way to reach young people. We have to speak in a language they understand and appreciate and they trust. And so I think that our faith community, our educational institutions are in a unique position to be a part of the solution.
Thank you so much. Thank you all for your time. We greatly appreciate it. And we will be back. We have another set of people, another set of experts to join us. Stay with us.
A year ago, I don't think any of us could have anticipated what was going to happen over the next year as a result of COVID. Going from the first couple of cases here in South Carolina, very quickly we saw sporting events get canceled. Things like eating out, even going to the store, become very different than they had been before. People wearing masks, social distancing, staying home when they're sick, and really even staying home when they weren't sick, became hallmarks of our new reality.
In public health, we have worked to prepare for potential pandemics for years. As early as January of 2020, we had numerous things in place to give us the ability to detect cases, to conduct case investigations, and it was our hope to be able to stop spread as soon as possible. As an agency, along with our partners, we confronted the challenges head-on. Every organizational unit ultimately provided some workers to help with their response.
We've done now over 2 million tests. That has been incredibly important, so we could identify folks who had the disease, both to help them medically, but also to limit the spread. With now 3 effective, safe vaccines, and lots of people getting the vaccine, we can really kind of see the light at the end of the tunnel. We are making progress. And thank you to all of our community partners. Many of them are volunteers, giving of their time, their energy, to make sure that we move forward. To the DHEC team, you've done an incredible amount of work. There's much more to be done, often in roles that were a little bit different than what you're used to, but you've stepped up, you've been flexible, and you've made sure that everything that we need to get done is getting done, and getting done very well. So thank you.
There are many who have worked almost every day, 7 days a week for almost a year now. Many, many people are thankful, and I want to express my sincere gratitude for the lives that they saved.
We can get through this together and come out stronger and better on the other end.
Some continued efforts on all of our parts. As a community, we will find our way out of this.
In the early days of the pandemic, older adults experienced adverse effects from COVID-19 at a far greater rate than any other group. Today, many, but not all, of our older adults, those 65 and older in South Carolina, have received COVID-19 vaccines. Meanwhile, we are seeing increasing numbers of younger adults testing positive for the virus, and some areas of our country are reporting more and more youth in hospital beds. Joining us to discuss how COVID-19 has and continues to impact families and reach across generations are Dr. Brandon Trexler, Public Health Director for DHEC. Also joining us, Connie Munn, Director of the South Carolina Department on Aging. We also have Molly Spearman, State Superintendent of Education. Also joining us is Malik Lewis, a recent graduate of Allen University. Felicia Vesey, DHEC's COVID-19 Response Operations Director for the Lowcountry. And joining us virtually from Florence is Leslie McGee, Senior Vice President of McLeod Health and McLeod's Incident Commander for COVID-19 response, overseeing 7 of their team's hospitals. Good evening to each and every one of you. Thank you for being here. We really appreciate your time. So I want to start with you, Dr. Trexler. When it comes to the impact that COVID-19 has had among our younger and our older populations, what trends are we seeing today and what do they mean?
Sure. So as you noted, early on in this pandemic, most of our cases, and especially our most severe cases, were occurring in our older populations. Mm-hmm. We were seeing certainly a lot of disease and unfortunately a lot of death occurring in that age group and among those who were in those long-term care facilities. As we have moved through the vaccination process and more of that group have become vaccinated, we're seeing trends shift down to the younger populations. And so we are seeing those teenagers and those young adults really making up the majority of our cases these days. And so that's why it is now so vitally important that they get vaccinated too. Now that we have a good vaccine supply, we've seen older South Carolinians really turn out and get vaccinated at great rates. And so we ask our younger generations do the same now that it's their turn.
Connie, this next question is for you. What challenges do we face when it comes to supporting our older populations? We received this question from a viewer. She asked, or that viewer asked, some individuals may be hesitant to receive the vaccine, but others, including those in our elderly populations, many are not able to use the website to find a provider or to drive them to a vaccination clinic. How are you guys supporting this demographic?
Well, early on, we realized that our elderly population is socially isolated and they don't have access to Wi-Fi. So in the very beginning, when we realized that was the population we needed to protect, we did things like shift and send home-delivered meals. And we just recently delivered over 4 million home-delivered meals. So knowing that our elderly don't go on the website and don't have Wi-Fi, we would send flyers. And we partnered with DHEC and had their phone number to call to give as much information as we could early on how to stay home and protect yourself, but now shifting and trying to get them vaccinated where they can go to get vaccinated. Social isolation is a huge challenge for us, and we know our older population, the trust factor, we work very closely with the faith-based organizations because we know our seniors will trust their pastors, and so we have been working with those as well to connect. But the most important part is that just trying to get our seniors and understanding that they do need to get vaccinated. And I am excited that about 70% of the 65 and older have been vaccinated. But we also have an issue with homebound. Many of our seniors are homebound. And so getting that population vaccinated, mobility and transportation are all challenges, but we have partnered with many organizations and agencies that assist us with that to get the word out for our seniors to get vaccinated.
Thank you very much for that. For our next question, we turn now to Skype. This question goes to Leslie McGee. What does the latest from the FDA and CDC concerning the use of the Pfizer vaccine for children aged 12 to 15 mean for South Carolina?
Well, I think it means great things. I think that the exciting piece of being able to expand down into a younger population gives us the opportunity to do as we've done for all of our immunization efforts, to be able to educate the parents and educate kids about why this is important. I think the really big challenge for us organizationally is that at 16 and older, you can give consent. Once you've got informed consent, you can actually choose to do your own vaccination in the state of South Carolina. And so we do have to make this a partnership with parents, with guardians, to make sure that they understand what their children are hearing about in school, that they're getting good information. But I believe that this, again, is another part of that solution that Dr. Trexler spoke about, with the growing numbers of children that we're now seeing with positive test results.
Thank you so much. Malik, I want to come to you now. Congratulations. You just graduated recently.
Thank you.
What are your plans, really quick?
I plan on going to graduate school at Florida A&M in Tallahassee, Florida.
Wonderful. So this question is for you. How do you believe our young adults can help make a difference when it comes to getting more people vaccinated?
Okay. We can start by spreading awareness amongst each other through social media, letting others know, like, hey, you know, it's gonna benefit you more than harm you to get the vaccine, killing those negative stigmas behind receiving the vaccine.
Do you see any challenges? I mean, you're a part of our future leaders, our young population. Do you see any challenges when it comes to reaching this population?
Just a little bit, okay, so a lot of this generation, we're more prone to social media. So like everything we find out or go through social media. It's never through a flyer or through email. We don't read emails, you know. It's always, if I don't see it on the commercial, I'm not gonna see it at all. So I feel like probably finding out a different way to really get it out there to us for most of us to see it. Like mainly I think right now, like TikTok is a big thing. So maybe if there's some way like we can like coordinate through getting it through that way so that others can see it.
Superintendent Spearman, I wanted to ask you the same question. When it comes to our younger population, how do you believe that they can help make a difference in this fight?
Well, I think for sure we need to have leaders in the younger population step up and show that they're willing to take the vaccine, whether they're the student body president or on the basketball team, sports team, cheerleaders, whatever, to show that they're willing to do it and to challenge their neighbors, maybe through TikTok, to participate as well. I think one of the things that I have had good response in talking to young people is to say, next year in school, if you get your vaccine, you won't have to quarantine. So that has really helped. They say, you mean I wouldn't have to miss basketball practice or football practice? So families need to realize that there are lots of perks that you get when you're vaccinated, and being part and not having to worry about having to be quarantined from your school activities are very important.
Thank you for that. So, Felicia, I want to come to you now. So, COVID-19 has uniquely affected children and families, from disrupting our normal routines, our conversations about mental health and social distancing, and so many other things. As we continue to increase education about this disease, what types of conversations are helpful for our families to have?
I think one of the conversations, a part of the conversation you should start having is knowing what kind of vaccines are out there, and then also making sure that people are aware of where to go for their vaccines. In addition to that, having the conversation about vaccine hesitancy and being transparent about why you're hesitant, and then getting with the proper expert or professional to address those concerns.
I also wanted to, I'm going to come right back to you, but Superintendent Spearman, as we prepare for the next school year, I'm a parent, so it's so many other parents out there. What should our students, what should we be preparing for?
Well, I hope that you're preparing for a pretty normal year next year. I certainly don't plan as state superintendent to give any mask requirements. That will be left up to local schools. But the point is, the more young people that we have vaccinated, the more normal the year can be. So it's really important for parents to make sure that their students, and this is one of those where parents need to have that conversation. And I know in Saluda a few weeks ago we had a drive-through clinic, and there was a mother who brought her children and said, you will get the vaccine. So this may be the time to use that parental authority and say, you need to take the vaccine, and take your children to get that.
In talking with parents across the state, what I'm hearing a lot from them is, yes, we understand that a lot of our adults, we have vaccines for our adults, and now for ages 12 to 15. There are a lot of parents that are still hesitant about sending their kids back to school because as of right now, we don't have a vaccine for kids younger than that. What do you say to them?
Right, well, we've proved that school can be a very safe place. Using the mitigation tools all year, wearing the masks, the social distancing, the cleaning. And so schools have been safe, but they've been safe because we've been using the mitigation tools. So we need to continue with some of those, but again, the more young people who get vaccinated, we can loosen that up and have a more normal year. So I would strongly encourage parents to get their children back into school. They do better, not just academically, but they need to be together for their friendships and to renew those friendships, to play together and have fun together, which is a big part of just being at school during the day.
Dr. Tressler, I want to bounce back to you. We have a question from a viewer. Nicole from Lexington asked, what would you tell a person who is allergic to the ingredients in the vaccine?
Certainly. So that needs to be a conversation that the person has with their own healthcare provider to really look at, to make certain that it is an ingredient that they had an allergic reaction to, and to look at the ingredient lists for the other available vaccines to see whether it is or is not used in those. It might be that they could safely use one of the others, but the main thing is that needs to be a conversation they have with their own healthcare provider about their unique situation.
We have so many opportunities for people. We had so many opportunities for people to get tested and now to get their vaccines, in-person opportunities, drive-up opportunities. A lot of people still are, they want to know what the process is going to be like. Open question, how is it?
Sure. It's very easy, and so I will give a very high overview, and then I would like Ms. Veazey to fill in, because she's really been out there helping run it in our Low Country. I think that you should be prepared for about 30 minutes. Is that what you would say?
That's it.
You have to wait for 15 minutes after you get vaccinated just to be monitored. Make sure you don't have an allergic reaction. Otherwise, it is very straightforward. We're not requiring appointments at most sites nowadays. It is very quick and easy. Do you have any specifics you'd like to?
For the Low Country region, I'm sure it's the same across the state. You can register online, or you can actually call in to our online, or call a number to register. Also, it is about walk-ups as well, so you don't have to have an appointment. As she said, when you come in for us, it's about a 30-minute time frame. You register, you sit in with your vaccine, and then you go and have to be observed for 15 minutes. So again, it's about a 30-minute process. What we're doing now in the Low Country is working with different agencies. We're going to churches as well as to workplaces to have a more focused approach. So before we were focusing on at our health clinics as well as some of the larger sites that we could use, but now we're actually going to more focus. So if someone can not come to our community events, now we can actually go to their jobs and get them vaccinated. So again, the time frame is about 30 minutes as a whole, but no appointments, or you can register.
I wanted to swing back to you to talk a little bit more about the conversations that parents and families should be having. Can you share what it was like for you and your family?
Sure. So in my role, I'm on a computer every day or in a meeting all day. And my dad got vaccinated at a community partner with FEDER. And when I asked him why he went to FEDER, he said, "Felicia, I don't know how to use the internet." And it kind of caught me, because I'm like, I sit at a computer all day, and here's my dad who didn't call and say, "Hey, Felicia, can you help me register?" And so from that, it started the conversation internally about how we could help seniors actually register. So we basically opened up a personal phone line, like a cell phone, that we had folks call in. But again, personally, it opened the door for me and my eyes to basically want to have access for anyone, not just having to go online, but actually having a phone line that they can actually call. So I ended up giving out my work cell phone just to help seniors get registered for our vaccine clinics.
And we're going to start with you, and we're going to do a quick round robin, or a round table, if you will. What message do you want to leave with South Carolinians watching this program tonight?
Get vaccinated. Look at it from more of a selfless perspective, because that's the only way that we're going to get through this. I have a friend who did not want to get the vaccine because she's concerned about the side effects, and I'm like, it's about a 24 to 48 hour period that you might have the side effects, but I'm like, that 24 to 48 hours is better than a long-term effect that you're going to have from actually getting the COVID virus. So just more so, think about your family members and your parents and everyone around you, and make it a selfless decision.
Thank you. I'm going to bounce it back over to Florence. Leslie McGee, what final message do you want to give to South Carolinians watching tonight?
Get vaccinated, ask questions, find out who can help answer whatever concerns you have, will help. I know all of the partners that have spoken tonight will help, but to not make an uninformed decision to just not get vaccinated. The other thing I'll tell the people who are trying to have this conversation with their children, it doesn't hurt. I think there's always this fear of it's a needle and I don't like a needle. It doesn't hurt. And yes, those side effects might happen, but they most likely won't. So go get vaccinated.
Malik?
To all my older or younger Carolinians, I want to say please get vaccinated. If not, stay masked up and social distance.
Superintendent Spearman.
So I would say to folks, let's have a normal school year next year. And to help us with that, take your children, get vaccinated. Teachers, get vaccinated. And anyone who works in the school environment, go get your vaccine.
Connie.
The same. You know, please get vaccinated and advocate, looking at the elderly, advocate for those. If it's your parent, your grandparent, we have intergenerational homes where there are several families that live together. And so if children are not getting vaccinated, it could affect their loved one and their grandparents. So please get vaccinated and advocate, reach out and help someone, an elderly who can't get on Wi-Fi or call, and help them get to the vaccine site.
All right. And our Public Health Director for DHEC, Dr. Traxler, you get the last word.
So I would say that every person who gets vaccinated is helping to save lives. It is making a difference. And whether it is someone who's older, who's maybe more likely to have severe effects if they got sick, versus somebody who's younger who might not get as sick, you know, statistically most likely, but could pass it on to somebody else. We all have to do our part. And the way we get back to our normal lives as South Carolinians is to all get vaccinated and get us to that point.
Wonderful. Thank you so very much. We thank you all for being here. For more information about COVID-19 vaccines, please contact the South Carolina Department of Health and Environmental Control. I'd like to thank all of our guests we've had here tonight who shared with us tonight. We thank you guys so very much and thank you for joining us. Good night.